all-new Dr. Oz. The latest on Joan Rivers' medical investigation. New clues to what happened in that room. Guidelines broken, consent violated, and an unauthorized doctor. Plus, did her doctor take a selfie while she was unconscious? What really happened to Joan Rivers? Coming up next on Dr. Oz.
It's been 2 weeks since Joan Rivers stopped breathing and went into cardiac arrest while undergoing a routine endoscopy. An investigation of the surgical center and her death has been underway for days, but we didn't have answers until now. CNN correspondent Susan Candiati spoke to a source inside that surgery center and is giving us exclusive insight and possible answers to what really happened to Joan Rivers.
A source tells CNN investigators are learning this. An unauthorized procedure, a biopsy on Rivers' vocal cords, was begun on the comedian while she was sedated. Staffers told authorities they found no signed consent form from Rivers. If so, ethicist Dr. Arthur Kaplan says that's a red flag.
Knowing exactly what's going to happen to you is crucial to any care interaction.
The morning began like this. Our source says Rivers was undergoing a scheduled endoscopy by the clinic's gastroenterologist, Dr. Lawrence Cohen, inserting a tiny camera down her throat looking for possible digestive issues, when staffers say Cohen saw something. While Rivers was still under anesthesia, staffers told authorities Rivers' personal ear, nose, and throat specialist examined Rivers' vocal cords and began a biopsy. And in addition to the fact the procedure was unauthorized, our source says the ENT doctor was not certified to operate there.
Even though you are a licensed physician, you still should have, if you will, the checks and balances to get you approval to practice in a particular place.
And there's more. In a statement, the clinic flatly says a biopsy of the vocal cords, quote, has never been performed at the clinic. While technically true, it doesn't appear to be the whole story. The ENT doctor may not have completed the biopsy, but our source says it was started. Our source says as the unauthorized biopsy got underway, Rivers' vocal cords began to swell, cutting off her oxygen, putting her into cardiac arrest. Doctor, if there were oxygen deprivation to the brain, what particular impact might that have if someone is elderly, in this case, 81 years old?
The effect of having no oxygen in the brain is damage to the nerve cells, which can precipitate as coma, paralysis. But in the elderly, you have less reserve, you have less of a window to correct it.
When Rivers' heart stops beating, seconds count. It's 9:40 a.m. The clinic calls 911. The call gets the highest code. 5 minutes later, New York Fire Rescue arrives. CPR is underway. A defibrillator is attached, a breathing tube inserted. Fire Rescue takes over CPR. 9:47, a Mount Sinai ambulance team arrives and joins the efforts. A minute later, a second fire rescue unit arrives. By 9:50 a.m., 10 emergency personnel are on the scene. 1 week later, Joan Rivers is dead. As New York's medical examiner and the state's health department continue to investigate, the clinic announcing a shakeup in a statement saying Dr. Cohen is not currently performing procedures, nor is he currently serving as medical director. At this time, a source says neither Dr. Cohen nor the ENT is being accused of wrongdoing. Citing federal privacy laws, the clinic declines comment on whether Rivers' personal doctor was there and performed a biopsy.
Today I've assembled some of the top experts in their fields to investigate this breaking news on Joan Rivers' death. Anesthesiologist and Chief Wellness Officer at the Cleveland Clinic, Dr. Michael Rosen, and ear, nose, and throat doctor and a world-renowned vocal cord expert, Dr. Jamie Kaufman. So, Dr. Kaufman, let's start with you. The CNN reports that they were actually looking at reflux as the initial cause. You've written a book on reflux. Was this the right procedure for Joan Rivers?
No, she never should have been there.
Should not have been there?
No.
And why do you feel so confident about that?
Well, reflux laryngitis, or reflux in the throat, is a diagnosis that's made by examining the throat. And most people who have such reflux don't have abnormal esophageal examinations.
And this endoscopy procedure is performed in an outpatient clinic, not in the hospital. Mike Roizen, as an anesthesiologist, what type of anesthesia do you think she should have been having? And could she have gotten it in that outpatient facility?
Well, you can get anesthesia for this. Sedation is different than general anesthesia. And so sedation performed here could have been done. But once you get sedation and are going to do a biopsy on the vocal cords or going to examine the vocal cords or going to probe through them, that takes you to a different level. You don't do that under sedation, light sedation, because the vocal cords can go into spasm, and this is a predictable event. So what you want is to have general anesthesia if you're going to do that.
So when Joan was on the show last, she confided to me that she was always worried about undergoing anesthesia. Take a look at her words.
My dad was a doctor, and he always said, be careful with the anesthesia. And every time I go under, I say the same thing, be careful. I am the only one my daughter has. Be careful, be careful.
I mean, it's heartbreaking to hear her express in her own words what ended up ultimately causing her demise. So let me show you what could have happened during Joan's procedure. During an endoscopy, the doctor inserts a long, flexible tube into either the mouth or the nose, and then it guides it down the esophagus, looking for digestive issues, usually the effects of acid reflux. That tube is often the size of my thumb, but there are smaller ones that now are used that can go through the nose that are the size of my pinky. Now, at this point, Joan's vocal cords should have looked like this. This is really important. The cords are here on the side, and there's a wide open path taking the air from her mouth down into her windpipe and back again, so she can breathe. But CNN reports that while performing the endoscopy, Joan's gastroenterologist, quote unquote, saw something on her vocal cords and asked Joan's ENT to take a look. The ENT, who CNN reports was in the room but not authorized to perform a procedure in this clinic, nonetheless decided to perform on the spot a biopsy of Joan's vocal cords. This was the decisive moment. Remember, Joan Rivers had not signed a consent for the biopsy. Dr. Kaufman, I'm just going to ask you a question as a professional. If someone needed a biopsy of the vocal cords but had not signed a consent, what would you do?
Never do a biopsy. Not without consent.
And Joan Rivers was 81. Does that change your opinion?
Not at all.
Still feel strongly?
Yes.
And this thing that they found on Joan's vocal cords, if you're not going to biopsy it at that point, what would you, in your best opinion, done with it down the road?
If the lesion looked to be dangerous, malignant, or some way needed biopsy, then it should be done in an operating room in a controlled environment so that airway problems like this could not occur.
So here's what apparently happened when the physician taking care of her started to try this biopsy. Joan's vocal cords started to swell and they closed off. Her airway, remember what it looked like before? Wide open with the air passing through? This is what it would look like afterwards. So over here you see there's no space for air to travel. The cords they're shut tightly. Again, she's under sedation, not anesthesia, asleep, so they're unable to deal with this ahead of time. When you can't breathe, cardiac arrest, your heart stops beating because you need the oxygen. Dr. Kaufman, how surprised are you that this would ever happen? Is it even possible? I mean, does it happen frequently in America? I mean, this is the first time I personally ever had experience knowing of someone who had this.
Sedated endoscopy, there were 8 million done last year. The reported death rate is 1 per 10,000, and that's in the GI literature. So we would expect about 800 people to have death due to endoscopy in this country in a year.
800 people?
Yes.
My goodness. So Mike, if this was happening in a moment like this, what would an anesthesiologist have tried to do to get Joan breathing again?
So the first thing is you've got a team that's prepared for it. And Dr. Kaufman and I would talk about what we're going to do beforehand. We would put a tube in past the lesion if she was going to biopsy that, so we could absolutely have breathing. And you paralyze the cords, meaning you don't let them move at all so that they can't go into spasm at that time, and also so she can get a better look and a better biopsy.
So what I'm understanding, and again, I don't do operation procedures like this as a heart surgeon, but an anesthesiologist does some fairly sophisticated things when the vocal cords have to be played with.
Absolutely.
And that's why you want to do them in a controlled environment with a team that's practiced. And the anesthesiologist and the ENT surgeon have worked together and know what they're doing.
So within 5 minutes of this problem starting to occur, from what we can tell, the EMTs were already there doing CPR. Dr. Mike, was it already too late?
We don't know, because we don't know how long it took for them to call the EMTs. In other words, you don't call the EMTs before a problem develops. So it takes some time of lack of oxygen to brain and heart before the event occurred that triggered, and we don't know how long that is.
There are also reports, and it pains me to say this, that one doctor was actually taking a selfie with Joan while she was sedated. Dr. Kaufman, thoughts?
Unprofessional. Never taken a selfie in an operating room, never taken a selfie with a patient.
So, in your opinion, which problems was the most likely responsible for her death, her untimely loss?
Well, yeah, she should never have had this procedure. She should have never had this procedure without a team that knew what they were doing, and she should have never had this procedure in this way that was unauthorized.
Dr. Kaufman?
She never should have been there in the first place. I would not have recommended this procedure, and I would have not recommended this place.
Why not the procedure?
She has reflux, probably. That's the most likely reason. This center does endoscopy for colons and for looking inside for reflux. This technology now can be done in an awake patient with an ultra-thin instrument with none of these risks.
So it's safer to do it awake
Absolutely.
than partially. So again, it's sort of like being pregnant. You're either pregnant or you're not. You can't be in the middle, which is what I'm gathering you're saying is what was going on here.
The greatest risk to the airway is in the patient who's sedated like this. This is an 81-year-old woman who's got vocal cord problems, who probably has severe reflux. She may have reflux during this event. Again, no protection of her airway. So either, doing this, using an ultra-thin, which is riskless. We've been doing these since 1990s, or in an operating room in a completely controlled environment.
And of the things I presented to you, what's the most egregious? What bothers you the most?
The biopsy idea that someone might, even if we're just going to suck off a lesion or to instrument it with a gastroscope or this type of instrument without airway control.
I want to thank you both for your honesty. I know this is a difficult topic. We'll be right back.
Coming up,
One of the most controversial topics in the medical community.
can a simple formula prevent Alzheimer's?
The food that you eat plays a role in your brain health.
The breakthrough that may save your brain. Next.
I'm very concerned that we're at the beginning of a catastrophe.
The show will challenge the food industry, the chemical industry, and the president.
We are running out of time.
All New Oz. That's coming up on Monday.
In the medical spotlight today, we're talking about a new simple formula to help prevent Alzheimer's. It's one of the most controversial topics in the medical community, and it has been making headlines all summer long. These are just a few pieces of literature that are talking about the fact that carbs could actually increase your risk for brain disease. Neurologist Dr. David Perlmutter is here today with a new memory-saving strategy. It's going to change the way that you eat. So explain a little bit about some of this research. Why the increased fear about carbohydrates and brain problems?
Well, I think what motivated it is we have no treatment for Alzheimer's. So now we're starting to look at prevention and looking at these lifestyle factors. What you talked about was a big meeting that happened in Europe where they finally validated the notion that, believe it or not, the food that you eat plays a role in your brain health. And we knew that about the heart, we knew that about bones, but now front and center, treatment of individuals changing their diets, reducing their risk for Alzheimer's, a disease for which there is no treatment.
So the last time Dr. Perlmutter was on the show, you all lit up my website. And here's the kinds of comments we got, things like, it makes sense, I've experienced it in my own life. I was really struck by this. It was a very popular experience for a lot of the viewers. But a lot of them wanted to know, what specifically do we do to reduce the risk of Alzheimer's? So we get the big idea, we have to cut back carbohydrates. Walk us through what those plans would look like.
Well, again, the foods that we've been told we should emphasize, like whole grain pasta, whole grain this and that, these are still powerful sources of carbohydrate, raising the blood sugar, and that is about the worst thing you can do for your brain. You've got to keep your blood sugar under control. Whether it's diabetes that you fear or heart disease, these things all relate to blood sugar.
So you've got a formula. It's going to help everybody lower their risk of Alzheimer's. Who's the best for? Who should start this immediately?
This is for everybody.
What foods should we avoid?
Again, this is the high-carb foods, the pastas, the breads, whether they're whole grain or they're not. They still spike your blood sugar. They have a high glycemic index. They've got to be taken off the table. We've got to welcome fat back to the table.
All right, let's talk about that a little bit. You've got a simple formula to help prevent Alzheimer's. The first item actually is about fat to fuel the brain. And very specifically, because we talk about fat a lot. Some of you think it's a culprit all the time. I've been trying to make the point that actually the right kind of fat can be helpful. You argue the right fats are which ones?
Well, wonderful fats, healthful fats, olive oil, avocados, nuts and seeds. You know, this is an incredible conversation. With a cardiovascular surgeon, we're saying eat fat, welcome it back to the table. These are fats that are important to reduce inflammation, that cornerstone of about everything bad that you don't want to happen to your body. And your brain is 60% fat. You build your brain from the fats that you eat. Healthy fat, olive oil. 2 tablespoons 3 times a day with every meal, olive oil, avocados, nuts, seeds, nut butters. This is brain healthy food.
The next big category that we want to address is you can actually swap in protein in order to calm down the inflammation. That's a big part of this Alzheimer's issue that you've been speaking about. Which proteins in particular?
Well, again, the grass-fed beef we've talked about, and I want to emphasize that the Grain Brain program is not one that is loaded up the plate with meat. That's not the answer here. Mostly on the plate are the vegetables. That the meat, 3 ounces perhaps at each meal, becomes sort of the side dish, not the focus of the meal. We want less aggressive proteins, but these are good sources of good fats. Eggs, we've demonized eggs to the nth degree. The glycemic index of an egg is 0. It doesn't have any effect on blood sugar, and yet it has in it cholesterol, which is good for your brain, associated with a reduced risk of Alzheimer's.
All right, the last ingredient we're going to speak about is probiotics, which will help protect the gut-brain connection. What are the best sources?
Well, these days, a lot of people are looking at fermented foods like sauerkraut. Kimchi is a very popular food in Korea, and it's a fermented food. What does it mean? It goes through the process of fermentation. It changes parts of the food, the sugars, into good bacteria. You're eating good bacteria, and it turns out that your brain is very responsive to the levels of good bacteria in the gut. This is the brain-gut connection that you mentioned. We are totally dependent on the health of the gut to nurture a healthy brain.
In fact, we now have data showing that probiotics in your food may actually affect how your brain functions. It's a real stimulation to take this. Now, I've got a little test for everybody, because I know we talk about probiotic foods a lot, and you all buy yogurt, right? Because you all think yogurt's the best way to get in your probiotics, which is a good way. There are others, as we talked about as well. But Dr. Perlmutter has a test, so listen carefully. This is a test to figure out if your yogurt has the probiotics that you need.
So what you do is you take your tablespoon of whatever yogurt you think is good, and you get some milk, get a bowl of milk, and warm it up. Don't boil it. Then as it cools down, take the yogurt, put a tablespoon in the milk, and in the morning, leave it out overnight and not in the refrigerator. In the morning, you should see that that has begun to, call it curdle or whatever you want, but it's going to change the milk. And if it doesn't change the milk, if you don't begin to see these changes happening, then you know that there weren't the billions of live cultures that everybody thinks might be in your yogurt. The reason you're eating yogurt, aside from the fact that you like the flavor, is because it has these brain-supportive, heart-supportive good bacteria, which are important for reducing risk of depression. Who knew that the bacteria living within your gut can control your brain's destiny? That's how important that is.
So one more time, just get a good look at this. This is the right result. It's curled a little bit. This is the wrong result.
Right.
It looks like it's basically colored milk when in the morning you don't have the right stuff anymore. This is actually how you make yogurt. I grew up with my dad making this. And unfortunately, too often times we're actually eating this, so you're getting tricked. And it really bothers me when you guys are trying to do the right thing but being taken advantage of. Dr. Perlmutter's new book is fantastic. It's called The Grain Brain Cookbook. It's the picture of it. It has fantastic recipes that follow this simple formula. You can find your favorites on our website as well. We'll be right back.
There are plenty more Oz-approved recipes on our website. Do you have a favorite?
I really wanted to give this recipe for Garden Delight roll-ups a try. I saw it on DrOz.com. As a vegetarian, I'm always looking for things like this.
Get this recipe on DrOz.com. Coming up, could this simple application be the answer to your mood and energy crisis?
The E patch. The E stands for estrogen, and it's getting a lot of attention.
Is this feel-good enhancer right for you? Or could it cause cancer? Stay tuned.
So this little patch be the answer to your mood and energy crisis? Well, some women say yes. I'm talking about the E patch. The E stands for estrogen, and it's getting a lot of attention. Women are discovering it and claiming it transforms their mood and energy. So today, we're gonna look at the E patch and find out if the patch is right for you. For years, doctors routinely prescribed hormone replacement therapy to treat the major symptoms of menopause: hot flashes, mood swings, and vaginal dryness. But then came the big studies that revealed the risks of hormone replacement therapy were too high. Women taking estrogen were more likely to get heart disease, strokes, and breast cancer. But after more than a decade of studies, many doctors today are once again advocating the treatment, even for younger women not yet in menopause. That's because new evidence shows low doses of estrogen can not only control hot flashes, but also improve mood and reignite your energy, without significant risks for serious life-threatening disease. Doctors believe the new E-patch could usher in a new era of relief for tired women of all ages. So Susan and Sandy are here, and at the end of this segment, I'm going to ask them if they would wear an estrogen patch after what they learned today. You ready? Yes. So you got to pay attention now. You guys can all help them out. First off, let me get started with the basic question of what is estrogen. We all know it is this female sex hormone, but you don't know sometimes where it's made. A lot of it, of course, is made down in the ovaries, in your pelvis. You all know that because when the ovaries don't function, it sort of goes away. But it's also made in the adrenal glands, which sit right on top of your kidneys. It's actually made in fat tissues as well. Estrogen circulates in the bloodstream and makes its way to almost every organ in your body. And it controls everything from your menstrual cycle to the building of collagen in your skin. It even helps in the development of strong bones. But estrogen also plays a very important function in your brain. Science tells us that estrogen affects serotonin and endorphins, the feel-good chemicals of the brain. And of course, they're responsible for your energy, your focus, and your mood. So the question then is the E-patch, which can bring you back the estrogen, right for you, and what are the risks? Gynecologist Dr. Tara Allman is joining us. She's a leading expert on menopause and recommends the E-patch for her patients. Welcome to the show.
Thank you.
So how would you know if you're low on estrogen?
Well, you know how they say little girls are made of sugar and spice and everything nice? Well, I like to say the everything nice is estrogen. And when we don't have estrogen anymore, we don't feel so very nice. So you know you're losing estrogen, you know you're low when you start skipping periods or stopping your periods altogether. And if you feel compelled to get an estrogen blood test, you can do that with your healthcare professional. But the key here is that you have to find a healthcare professional who really understands midlife women's health. You have to graduate from your OB's office. It's time.
This is an area that's been hotly debated because a lot of doctors say taking synthetic estrogen actually could increase the risk of, for example, breast cancer. So how do you respond to folks who are living in that fear?
This is the most important question that you're asking me today because it's the fear of breast cancer that prevents symptomatic women from trying the E-patch or hormone therapy. So it's my job today to simplify the answer. If you're a symptomatic menopausal woman, you're a candidate for the estrogen therapy, the risks for breast cancer are so very low and the benefits are so very great. So let's push our fear of breast cancer over here and let's find an expert who can really help us.
This little patch that I showed earlier, it's tiny, it's itty bitty little thing.
Yeah.
I mean, how much estrogen do you get from that patch?
It's really like a drop in the ocean. So your levels are already very low and you just need a little bit to get right through to your brain to help with your symptoms.
And I know about creams, which I think are used for different purposes generally, pills, and now the patch. So which one is the best one for us to use?
You know, it's a complicated answer, but if you want to use the E-patch, it's great because it's very simple to use and it works very rapidly.
And you don't have to take it every day, right?
That's right. It's either a once or a twice a week patch.
And when should you use the cream?
Again, very complicated, but the cream is good for local symptoms, for vaginal dryness symptoms, so that's the best place to use the cream.
And it's sort of a broad question, but I'd like everyone to understand, who would you use the patch for? Who's it right for?
Well, I'm the right candidate. I'm turning 50 years old this year, Dr. Oz.
Congratulations.
Thank you very much. And I am joining 60 million, thank you very much. I'm joining the 60 million menopausal women today who are symptomatic. So any of us who are symptomatic are the right candidate for the E-patch.
So we asked one of our viewers about the E-patch. She's currently on it right now, and her name is Julie. If you don't mind, Julie, take a stand. And thank you again for sharing your experience with us. What's it been like for you?
Since I've been on it, it really has may be able to function again. I've been on it about a year, and I can be myself again. I used to say that if you looked in the dictionary for menopause symptoms, you'd see my face. I'd have what people know about, like the night sweats and the hot flashes and the mood swings, which, let me tell you, is an understatement for what they are. I had anxiety. I had terrible anxiety. I had brain fog, or migraines, insomnia, fatigue.
Oh, the whole laundry list. So how
yeah.
much did it impact it? How long did it take? I want to understand the experience more.
It took a little while to diagnose me, unfortunately, because these symptoms also mimic a lot of other things. Your thyroid.
But once you started the patch, how long
Once I
from
started, 2 weeks. Literally, within, I'd say the first week, the anxiety calmed down. The night sweats calmed down. It really was an immediate kind of help to function. My brain wasn't functioning. I would go to the bank, I wouldn't know my numbers, I wouldn't know my phone number, I wouldn't know anything.
And you know those numbers now?
Oh, absolutely.
Okay, just making sure.
No, absolutely.
So, thanks for your testimonial. Dr. Alma's given us a lot of wonderful information as well. Now we have our 2 judges.
Okay.
So, who wants to go first? Susie, you want to go first?
Sure.
So, thoughts?
Well, my whole fear has always been a health risk of breast cancer. So that really is what kept me away from trying anything like this. But I now it's something I'd absolutely look into for my energy.
Sandy?
I would have to agree. I have researched, I've Googled, I've searched every avenue there is to search. But if I could take away, mine would be anxiety. And with anxiety comes the sudden flow of heat in you, and the hot flash comes with that. And your eyes are tired, you're just tired all the time. So I just want to be the person I was before. I want to be the chipper person and just bring back my energy. So I would definitely, after hearing her and the symptoms of less than 2 weeks, I would definitely give it a chance.
Thank you for both your thoughts.
Thank you.
I appreciate it. I hope it's been helpful. For a list of facts every woman should know about estrogen, go to droz.com. And you can also go to the Ask MD app to help with any other symptoms that are worrying you. We'll be right back.
Next, 75% of American women will have it in their lifetime. A yeast infection. What you're eating may be the cause.
The yeast love that.
The solutions to treat and prevent.
That's delicious. We're going to teach everybody in America about yeast.
Coming up next.
I'm very concerned that we're at the beginning of a catastrophe.
The show will challenge the food industry, the chemical industry, and the president.
We are running out of time.
All new Oz. That's coming up on Monday.
My next topic is in this cup. It's a condition that 75% of American women will have in their lifetime. Who wants to diagnose this? Who wants to take a smell? Let's just go down the aisle here. Take a whiff of that.
Oh, what is that?
You don't know what that is?
No, what is that?
Yeah, you're not going to know. No. I can tell you. Men don't get this. Let's see.
Oh, not so nice. Yeast.
Yeast!
Infection.
We have our assistant of the day. That's it. Come on up. She just won. You got that pretty quickly.
Well, I've actually had a partial sigmoidectomy.
Oh my goodness.
And as a result of some antibiotics, I've suffered a yeast infection.
Right, come over here. Hold that mic for 1 second.
Surely.
Now, who's that behind you? Who's that friend?
Kim.
Kim?
My very dear BFF.
And turn around for a second. Let me put this jacket on you.
Oh, my mother would die.
Oh, she would, wouldn't she?
She would die.
Okay. What's your first name?
My name is Vicky.
Vicky.
Yes.
Thank you for being here.
Thank you.
Your mother's going to die, huh? She's not going to believe what you're talking about
I'm wearing
this.
a Dr. jacket.
Yes. Well, Dr. Jack is part of it. Come back behind this.
Okay.
We're going to teach everybody in America about yeast. Now, I must say I was very impressed. The male, not surprisingly, missed. Thank you for trying, sir. But it's an infection that affects a lot of folks. And I want to talk a little bit about why we get it and what we can do about it once you understand that. So let's walk through some of the things. You mentioned you were on antibiotics because you had an operation.
Mm-hmm.
Common cause birth control pills do it.
Mm-hmm. Yes, that's true.
Sugary sodas do it a lot. You know why? Because sugar in general does it. And when you have sugary sodas, you drink a lot of the sugar. So it's much more common to get yeast infections with that.
Interesting, I didn't know that.
Now that you know, you can keep track of people don't even realize why they get it. They just get frustrated. And sometimes eating foods that have yeast in them can cause problems. Cheese obviously has yeast. That's how you make it. Peanuts will often have yeast in them. Wines, beers, they have products in them. So unfortunately, there are many different ways you can get this. Now, besides the one-time antibiotics that you mentioned recently, do you take birth control pills or?
No, I do not.
All right, so those aren't risk issues. And soda pop, you drink or not really?
Well, I in the last 14 months, lost 97.2 pounds.
Have you really? That is unbelievable. Nicely done. Okay, now we've covered some of these foods. I want to show you why these foods sometimes cause a problem, but you need to pick someone from the audience to help you.
Oh,
Nikki.
Kim.
Kim? Come up, Kim. Come on, Kim. Who wants Kim?
Give me a big hug.
You must be very proud of your friend.
I'm super proud. Oh my gosh.
97.2
I
pounds.
know.
Come over here. You're going to love this. Now, the two of you look like you're fairly athletic. So, Vicky, run around that side. Vicky, go that side. Kim, you come over here. Pick up the rope.
Oh my God.
Vicky, you get to play bacteria today.
Okay.
Congratulations. Your mother's really going to be mortified now. Kim, you get to actually be yeast.
Okay.
And there's an equilibrium. Everybody who can hear my voice, the women anyway, have bacteria and yeast down under there. The guys have it too, they just don't have that area to call it that, right? And they balance each other out. So go ahead and pull your tug of war, and you keep this right in the middle because you're balanced, all right? But even the smallest thing can tip that balance over. For example, you mentioned antibiotics, all right? So let's say you've got antibiotics on board. It could even be for a sore throat. There we are. All right, now you got to keep that balance. Is that tight enough?
Yes.
Okay. Now you're being pulled over a little bit, right? And that begins to slowly move Kim into a power position. And then guess what? Even though you're on a wonderful program losing 97.2 pounds, you have some carbs or sugar. What we all do in America, give me one of your hands. Hold that there for me. Got you. Now, go ahead and pull away, Kim. It gets harder. It's getting harder. And then right when you're about to be pulled over the edge, daily stresses pop in. Right? You got to pay the bills, take care of the kids, homework. Your weight didn't go down like you wanted it to today because something small happened like this. And guess what happens?
Yeah.
Ta-da! The seat of stress. Have a seat. Now, Kim, take it away, Kim. Feet up in the air, and before you know it, guess what happens? She's pulled into yeast land.
There we go.
And now, unfortunately, you're stuck. You're stuck with a yeast infection. All of these things. So,
Oh, I love it.
you love it? So this can be yours.
Okay, good. Now I get to do it.
And you get to have the hat because I'm taking your friend
All right.
to the next step. So you can put your rope down. Nicely done. Thank you very, very
All right,
much.
thank you.
All right. So the goal is to restore this balance we just talked about. How to get you from being pulled across the line from bacteria to yeast. So a couple things, and there's some myths out there, all kinds of myths about yeast infections because it's so common. You may perhaps partake in it. And when you got the yeast infection after taking the antibiotics, what did you do about it?
Well, I tried the natural approach by adding yogurt into my diet.
Oh.
I thought perhaps doing the active cultures might help. I mean, it's something I've heard and
You
read
took it from
about.
above or below?
Both.
Both.
And it seemed to help. But nevertheless, it is a very uncomfortable.
So let's go through the whole equation. Now that you understand more about this balance between bacteria and yeast, your best friends are actually bacteria. You want the right amount because they'll protect you. So if you eat foods that bacteria don't like or mess you up, then they throws you off. So you got to do two things at once. You got to beat down the yeast and boost up your bacteria, the good bacteria.
Okay.
So first, to beat down the yeast, cut the sugars out. How do you do that? You mentioned this looks like probably one of your breakfasts.
This is exactly my breakfast.
I'm so proud of you.
Thank
I'm seriously. I love when people on their own figure out the things that really work.
Well, this is a great show for information, and you were a source of it, so thank you.
God bless you. Thank you very much. So, a low sugar meal will get you in the right spot. Start off with breakfast. That way you don't have the ups and downs. The sugar spikes in the morning. The yeast love that. Right? Also, yeast love to grow in dark, moist places. So I know these don't look too attractive, but something like this, you can wear bikini versions of this as well. Right? Wear loose clothes during the day if you can. Cotton that wicks and breathes and the like. Do you have anything like this lying at home?
That's private. I'm not telling you.
Okay. That's right. Your mom's watching. Okay. Then you want to also boost up the bacteria. So you mentioned yogurt, which absolutely does work, but sometimes you got to combine it because if yogurt's the only thing you eat, and if yogurt doesn't have live cultures in it, and a lot of today's yogurts don't, it won't work for you. So any foods rich in these probiotics will work well. They'll all serve as antifungals. So sauerkraut, kimchi, miso soups. Do you like any of these in particular?
Sauerkraut. I really enjoy sauerkraut.
So if you like sauerkraut, then try the kimchi. Because I know you'll like that then. And these are easy to find in homes all over the place. They're in Japanese restaurants, but you can make them in your house as well, and they're very inexpensive.
That's delicious.
Isn't it great?
It's great.
All right, so if these don't work for you, then the last option which is a reasonable one. I just don't want it to be your first option, is an antifungal cream. They work well. Get them in a pharmacy. Probably worked for you when you tried it.
Yes.
3 days?
About that. 3 days.
Usually, and that's, don't overdo it. It's going to end with an A-Z-O-E, an A-Z-O-L-E, azoles. They have many different names for it, like metronidazole, etc. Find one that you like, use it 3 days, no more, get off it, and then get back on this program and beat back the problems for yeast infections.
Great.
I thoroughly enjoyed
Dr. Oz,
having you.
thank you very much.
God bless
What
you.
a lovely...
We'll be right back.
Coming up, strong is the new skinny.
Most women really can't be these skinny waifs, but everyone can be strong and everyone can be powerful.
The 10-minute plan to help you build muscle and burn fat.
Is that all it takes?
Easy steps to help you move it to lose it. That's next. Have a health question? Ask on DrOz.com and get answers directly from Dr. Oz and his team of experts. No question is off limits.
This season, I am bringing healthy back, and it starts with the steps you need to help you move it to lose it. So today, I've got the 10-minute exercise plan to help you build up muscle up, the one you want, why you torch the fat. Joining me is health and fitness trainer Jennifer Cohen. 10 minutes. Is that all it takes?
Well, listen, all activity is great, but these short bursts of intense exercise has been proven to be more effective than these like long, steady-paced durations. And the reality is small wins equal big change. And so people, if they're not really big like exercise people, getting them started in 10 minutes is way more effective as well.
You've got a very different philosophy about what we should be seeking with these exercises.
Yeah, well, my whole concept is strong is the new skinny, which is the title of my new book. And really, we're in the middle of this really amazing cultural shift right now where women just don't want to be these skinny waifs, but they'd rather be these athletic, strong, empowered women. And the reality is most women really can't be these skinny waifs, but everyone can be strong and everyone can be powerful.
Who wants to be strong and powerful? All right, coming over here. We got a bunch of viewers who are here to build their strength and torch their fat. That's what you promised them.
Good,
Right.
I'm here to do it.
All right, 10 minutes is all you get. Give us the basic exercises. Folks at home, we'll do a few minutes here, but you can repeat these at home. Where do we
Exactly.
start?
All right, so grab onto your weights. You can also use water bottles at home if you'd like, whatever's more convenient. And we're going to start with our toes facing the corners of the room, and let's get into a plie position. So make sure your knees are just over your toes, your tailbone is tucked underneath, and then you're going to take your weights in front of your body and go all the way over your head and then all the way back down. Now this is great for your shoulders and your back acts like at the trunk of your body where everything else branches off. So you really want to make sure you really strengthen your back. You can actually look 10 pounds lighter if you have a strong back.
How do I look?
You look fantastic.
All right.
And so that's the move. Try to do this for 30 seconds, build up to a minute as you get more advanced.
So it's more about time than the number of repetitions.
Exactly. I prefer time because you can see your progress better than just doing it for like 8 reps or 12 reps.
Okay, lateral
All
lunge.
right, so let's go into the next one, the lateral lunge. So just actually grab onto one weight, everybody. And then we're gonna step out to one side while bringing your weight down, keeping your chest lifted, and then come right up into that half X. So you really work your balance and your coordination at the same time as working your lower body and your upper body and getting some cardio in. So I really try to make every move I do get the best bang for your buck. Cardio, strength, by working multiple body parts.
And again, 30 seconds to up to a minute?
Exactly, each side. So don't forget to do the other side.
Okay.
So at home. All right, so the next move is we're gonna go into an alternating cross leg push-up.
Ooh.
So let's get into our push-up position by putting our hands right underneath our shoulders, then take your leg, cross it under your body, keep your belly tight, and then do a push-up. Now, if you're just beginning, you can just stay static. So if someone at home or here is just starting out, just stay in your position.
How many
and as
push-ups do we do?
Well, you do 30 seconds again each side, up to a minute.
Oh, this is hard.
And then change sides. Ready, go.
You guys doing okay back there?
Yeah.
They come help me, because I'm not. All right.
You did great. Now, we have one more move to show. Let's get into our tabletop position here. Our hands on our knees, grab onto a weight or a water bottle. Now extend one leg out towards the back of the room, and then one arm goes forward, and then you crunch in the middle and come right back. Now again, this is a great move just for your abs, for your butt, and for your legs, but it really tightens the jiggle right over here where most women are always
Yeah, I hate that jiggle on me.
Oh yeah, well.
I feel like Superman now.
And again, the same thing, 30 seconds per side, and work up to a minute. And that's basically.
What do you guys think? You into it? All right, you can check out a full list of exercises in Jennifer's new book, Strong is the New Skinny, just in 10 minutes to get you to torch that fat off. We'll be right back.
To stay healthy and in shape, tell us, what's your biggest inspiration?
My son, Luke. I'm so very blessed and honored to be the mother of this amazing child.
We'd love to hear from you. Share your story with us on Facebook.com/Dr. Oz. A Dr. Oz alert. The new GMO pesticide arms race doctors are warning against. The health of your brain could be a casualty.
I'm very concerned that we're at the beginning of a catastrophe.
This show will challenge the food industry, the chemical industry, and the president.
America, we are running out of time.
All new Dr. Oz. That's coming up on Monday.
Now it's time for In Case You Missed It. First, we're going to talk about swapping in proteins. Dr. Perlmutter is absolutely right. Our plates are way too carb heavy, and following the simple formula from today's show could help you prevent Alzheimer's. It's a big deal. It's worth the investment of time. You want about 80 grams of protein a day. That's about 3 to 4 ounces of meat per meal, but there's many ways of getting your protein. Just make sure you're getting protein and not simple carbs especially. Next, 75% of women will get a yeast infection in their lifetime. So here's how you treat one. To beat down the yeast, starve them. Yeast feeds on sugar. Eat a low-sugar breakfast especially. That's going to calm down those early morning sugar spikes that yeast thrive on. So, for example, this is an omelet, again, with veggies and tomatoes. Not a lot of sugar in this. Veggies, and in particular protein, will really hurt that yeast and prevent it from growing. Yeast also love dark spaces and moist spaces, which is why they grow down there. So you want to wear loose clothes during the day. You can wear cotton white underwear. I know most of you aren't going to wear these, but you can find alternative versions of these that would work for you. It's worth doing that rather than having to continue to treat yeast infections. And let me close with a warning. Please be careful about what you buy online, especially weight loss pills. There are some dubious people online that prey on folks like you who are trying to do the right thing for your health. Sometimes they even try to make it seem like I'm endorsing their products. I don't. To see a full list of our trusted sponsorship partners, you can go to DrOz.com. I'll see you next time.